person who said I would never run federally in a million years. Ever, 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 ever. I came out of school board, provincial politics, municipal politics, and said, I'm done. And I meant it. And then there was an opening in our riding, and then Jack called, etc. And I'll tell you, the reason that I ran federally was because of healthcare. I didn't run for other kinds of reasons, although I'm concerned about all the things that the party that I represent is concerned about. But I ran because of my concern about healthcare. It's not, wait times are not a myth, but they have been made to be larger than they are. Now that doesn't mean we all don't know people who've waited way too long for surgery. But the myth that the only way to reduce wait times is by private care is absolute nonsense. The Conservative government has dropped their fifth priority, which was wait times, and it suddenly disappeared one night, you know, into some ether land, and they have some other goal now which has nothing to do with healthcare. And in spite of that, in some places across the country, wait times are going down. And they're going down by people doing basically some very simple things that they should be congratulated for, but we should do more of. I actually had a motion passed at the health committee that I sit on to have a national database of innovation, where if you're in a little hospital in PEI, you can find out what somebody in a hospital in Saskatchewan is doing to reduce their wait times. Why should anybody reinvent a wheel? Do you know that there are hospitals that have reduced their wait time by starting on time? I swear. Look, scientifically based evidence, right? We all talk about scientifically based evidence decision making. Well, by starting on time. My hospital, all it did was devote 2 ORs to orthopedics, so that the orthopedic surgeon didn't have to stand around while they cleaned up the other OR, which had been used for a gallbladder. And so the surgeon could move from one OR to the other, and it moved through at a much faster pace, and they brought their wait times down. That's not magic. I don't think that requires a great deal of, creative thought, but they were able to bring their wait times down. I'm not saying wait times aren't an issue by any means. Don't misunderstand me. But there are ways that can happen. And the Conservative government, instead of helping it happen, has just abandoned it. The only thing Tony Clement has done is make an announcement last week, which is beyond my comprehension, which is a pilot project on wait times on 6 reserves in Canada, that Aboriginal women shall not have to have wait times for prenatal care. Well, you know what? Aboriginal women don't have wait times currently for prenatal care. They have issues of access and getting women to go early enough, but it's not wait times. And the fact that he would do that, right, while ignoring the fact that we can do prenatal wait times, and those people are going to go back to places like Saskatchewan, where they're going to live in environments that it doesn't matter how much good prenatal care you got. They're terrible communities with poverty and no safe drinking water and any of that. So, I mean, they have simply abandoned. They put it on their platform and they have no idea what to do. But there are ways it can happen. So I think we should all be saying, what are you doing, local hospital, whichever you are? What are you doing, Surrey Memorial, which is where I'm from, 400,000 people? What are you doing to reduce wait times? We should have forums in communities and ask, because actually some are doing it and the other ones are being pressured into it. They may be even pressured into by the talk about wait times, for all I know. I want to talk about drugs for a minute, right? And creating a national pharmaceutical strategy. So I'm talking about the things that I see every day that I think we can make a difference in that will make health better for people. So create a national pharmaceutical strategy across the country. What if the government did bulk buying? Ampicillin, which is a really simple little antibiotic that you probably gave your children or somebody gave your children when they were little or whatever. Well, bulk buying would reduce the cost. Sandra and I were driving around. There are many big box stores here in Edmonton, aren't there? But do you know why it's cheaper there? It's bulk buying. Well, bulk buying for pharmaceuticals, it's done other places. That's not hard, that's not a magical solution. So bulk buying would make a difference. We do have a crisis in health professionals, and it's not just doctors or nurses. It's because everybody says doctors, doctors, doctors. Well, yes, we need more doctors, and we need more nurses and dietitians and technicians and physiotherapists. It's not only doctors. But I don't know how many foreign trained doctors there are in Alberta, but I certainly know there are in Calgary, because I know some of those people. And so Mr. Clement put some more money into some education, helping rewrite education curriculum for foreign trained doctors who need to study when they get here. That's not the problem. They do all that studying, they pass the exams, but there's no residency place for them. And so if you went to my community and said, what's Canada done for you after they attracted you as a foreign doctor, they would say they taught me to drive a taxi cab. Because every fourth taxi cab driver is a doctor. And we need them. We need them. We need them all over, right? Sandra said to me today how hard it was to find a family physician when they moved here. Never mind if you live in the northern part of provinces where people aren't practicing. So we do have a real healthcare practice, and we should be, A, paying more attention to that, and secondly, looking at the portability of training. Surely if you trained in Nova Scotia as a physician, you shouldn't have to rewrite the exam in Alberta or in Manitoba or whatever. We just put up barriers all the time when we could be taking them down. When Tommy Douglas brought in Medicare, he said that the part that he started was only part one. Nobody ever remembers this part. That was only phase one. He said, phase one will be really easy. So that was the doctors, the hospital, etc. Compared to phase two, which is prevention and promotion. And he talked about that. If you read about it, he'll talk about 2 phases to Medicare, except we lost that one. And prevention and promotion has become the poor sister of healthcare, right? Maybe if you've got a little money, you might put a little over there. But really, we want it in the doctors and the hospitals. We want more hospital beds. Well, I don't want to have more hospital beds and more physicians and just as many patients in 10 years' time, because we haven't done any prevention or promotion so that people don't end up in those hospital beds. And we can make a difference in prevention. He talked about that when he brought it in, and we haven't done anything about it for, well, little bits, I don't mean nothing, but for 45 years, 50 years. We talk about obesity now some, but I'm talking about promotion that begins when kids are little, when they're infants, with parenting skills, all of those health indicators that we know make you a healthier adult. Like education, the single biggest indicator of whether you'll be healthy as an adult is education. It's not money. Well, it will be money if you are living on the street with nothing to eat. But in general, it's education. So we can't just separate this off and say you'll be healthy if we have more beds and all of that. So, Tommy, here's a room full of people who are all prepared, right, to go out and do this work. And I think in part it's about pushing our politicians, having public forums, writing letters to the editor, showing up at hospital board meetings or health authority meetings. I have a whole list of things that I think that we can do.